Hi, this is Dr. Philip Grandin. I'm an orthopedic surgeon at the CHUM in Montreal. This video is for my patients to show them how to change the dressing in a sterile fashion 2 days after the surgery. Usually the first follow-up visit after an ACL surgery, which is this is an ACL dressing, is 6 or 7 days after in Montreal at this hospital right now. You can keep it until the ICU and just it's sterile as long as it doesn't get wet. Now, if you want to have a less bulky dressing, you can at 2 days change it as long as you do it in a sterile fashion. If you're not comfortable, you could just go to the CLSC and do that there. So at 2 days, you can just remove this. This is a tensor bandage that just unrolls, and then there's a cotton roll that's also unrolled. And this dressing underneath is often a little stuck from the dried blood from the surgery. Okay. So you just remove it, and it'll be a little stuck, and it'll come off. And what stays is the Steri-Strips. So this is the ACL, the bigger incision. A knee meniscus surgery will not have this incision; it will only have these smaller ones. The smaller ones are actually waterproof at 2 days. You can shower them at 2 days. It's this one that I prefer to wait 10 days to shower without anything, and 5 days to shower with a waterproof Band-Aid. Before the waterproof Band-Aid, I would shower with a bag of plastic, the waterproof Band-Aid and a bag of plastic that you tape here so that no water gets through for the first 5 days. At 5 days, you can just shower over the waterproof Band-Aid, and at 10 days, you can shower with nothing, no Band-Aids whatsoever. So, the way to stay still, as long as I haven't touched it, I can just take a Band-Aid and open it in a sterile fashion. Now, if I did touch it, I could just take some alcohol swabs that you can buy here, some isopropyl alcohol 70% swabs. It's for like 100 swabs. It's $3.80 at your regular pharmacy. This is a Pharmaprix pharmacy, but they're all similar. And if you don't have that, even some 70% alcohol, isopropyl alcohol on a regular napkin can just dab it if you touch it by mistake. Now, if you don't, you don't have to do that. You don't touch it at all. So now you take the Band-Aid, and the Band-Aid, you can buy Band-Aids. These are for 6 Band-Aids. There's $8, 8 Canadian, and it's 7.3 by 10 centimeters, and it says sterile Band-Aids, sterile pads, and so you can. These are sterile, and this also says waterproof and sterile there. And so they're a little under $1. A Band-Aid. So as long as you open it without touching the center white part is the sterile part. As long as you do that, it stays sterile. If you touch a little bit of the edge of the white, it's okay, because that's not where the incision is going to be. So here, depends on the incision, but you try to cover all of it, and you can put it here like this way, over this, and now that's sterile. And this is waterproof. You could take a shower if it was really a good seal at 2 days, no problem. But because sometimes the seal is not perfect, I like to wait till 5 days to do that, and before 5 days to put a bag in a plastic, like a garbage bag, and tape it here so that no water gets to this. And if it did get to it, you have a waterproof Band-Aid, so that works. At 5 days, you can shower with it with no bag, just this, and at 10 days you can shower without anything. These small Band-Aids are actually waterproof. You can get them wet right away without a problem. But if you want to prevent a bit of blood from staining your pants or whatever, you can put just a regular Band-Aid here. And again, these aren't sterile, these are regular Band-Aids, but I don't touch the center on purpose just to keep it clean, and then just put it over one of these X's. There's 1, 2, 3, 4, but put this over here just to cover the blood so it doesn't stain your pants. These Steri-Strips, if they start to unglue themselves, you just cut off the part that's unglued. At 14 days, if there's still anything on your knee, you can just take them off and nothing else. That's about it for the knee. The knee scope for just a meniscus doesn't have this part, so you can remove everything at 2 days and take a shower at 2 days without a problem. The arthroscopic shoulder is the same thing at 2 days. You leave the big dressing, whatever stays stuck, which is the Steri-Strips, you keep on for 2 weeks. But you can shower and get those wet at 2 days. Okay, thank you.